It's a scenario that any practicing doctor will be familiar with. You're having a really busy day, it's so hectic, you're working full steam ahead to get everyone better, and suddenly out of the blue you'll receive that unexpected phone call. Mr. Johnson and his family are very upset and want to speak to you now. Initially, most doctors' reaction will be one of frustration, irritation, and disappointment. Oh my goodness, we're working so hard for Mr. Johnson, we've done everything for him. What on earth could him and his family be upset about? Such difficult people, so ungrateful. These are the kinds of thoughts that would be going through any doctor's mind. This is such an important moment of the day because on a human level, and I'm not just talking about physicians, when any of us feel like we're being attacked or our work is being questioned, the natural response is to become defensive, angry, or worse still, attack back. Unfortunately, it's a moment that many physicians don't handle as well as they could, for a number of reasons, including sadly a lack of communication skills training in medical school. My name is Suneel Dhand, and here are some golden rules for when any doctor next receives that inevitable phone call about the angry patient or family member. Number 1, take a deep breath. Remember, we are working in an emotionally charged field, unlike any other. Patients and families are frequently not themselves, and they are at a very, very low point in their lives. We must therefore cut them and their families some slack in the emotions department. Number 2, do your homework before the meeting. Try to get a handle on exactly what the situation is, usually from the nurse, before the meeting. Always try to familiarize yourself with all details of the illness and treatment strategy as well. Number 3, listen. When you walk into the room, walk in calmly and confidently. If you know what the problem is and it's appropriate, you can start off immediately by apologizing with a statement like, "Sorry for the misunderstanding, sorry for what happened." Then comes a "tell me what happened" statement. Let the patient and family describe to you the events that transpired and how they feel. Just listen, 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 and absorb, absorb, absorb. Don't speak. Number 4. Go over things again. After they finish talking, it's your turn. Describe briefly and succinctly again exactly what happened and make sure you've got it right. Then make it clear that you are looking forward to the future and you will formulate a clear plan to rectify things. Always ask if there's anything else they think you can do to help. Number 5, close the loop. After you're done, it's really important that patient and family don't get the sense that you've just disappeared. Ideally, check in later the same day, or if you can't, the next day, to make sure that all problems have been addressed and to also show that you genuinely care and want to solve the problem. 3 things that you should never do include acting defensively, dismissing any concern, or aggressively defending a situation, no matter how you feel. It's my observation, having seen hundreds of these types of situations unfold with myself and other doctors, that well over 90% of the time, patient and family complaints have a solid basis in reality. Very few people out there are truly unreasonable. By utilizing the correct communication techniques, almost any tense situation can be quickly diffused or calmed down. Get things wrong, however, and things can quickly spiral out of complete control. Ultimately, these suggestions would work in any industry, not just with physicians. Whether you're a hotel manager or a restaurateur, people are people and the same emotions always apply. Never respond to anger with anger or pour fuel on the fire. Choose to respond in the correct and calm way. Viktor Frankl, the famous neurologist and psychiatrist, as well as being a Holocaust survivor, once said, "Between stimulus and response there is a space. Within that space is your power to choose your response." Those are very wise words. Next time you're faced with an angry or tense situation, go into the zone of being the active listener and problem solver, always being the good, empathetic, and compassionate doctor.